All right, so keep in mind that my equipment that is on the tray, it has already been wiped down. That helps to preserve the sterility of the procedure. Another thing is that with our Foley catheters, we need to have that appropriate reason. So a couple appropriate reasons would be difficulty urinating, urinary incontinence, urinary retention, and pre-post surgery. And then one of the risk factors of having the catheter placed, and it's probably the biggest one, is risk of infection. A couple of signs and symptoms would be pain, it could be warmth around the genital area, and then redness and swelling or edema.
So today we are going to insert a Foley catheter. So the first thing that we want to check is the provider's orders and to make sure that there is an appropriate reason for our Foley catheter. Next, we're going to walk into the room, perform hand hygiene, and then I would identify myself and then ask the patient for 2 identifiers, so their name and date of birth, and then I would double check with their wristband. From there, I would make sure that I have my gloves on. And then I would inform the patient of the procedure that we're going to do today, see if they have any questions, and to make sure that it's okay that we perform this procedure. Ease their mind by answering any questions as well. Before we would start, there's a couple things that we would do. The first one is perineal care or perineal clean. And before we would do that, we would want to lift the bed up to promote proper body mechanics. So I'm going to go ahead and I'm going to lift the bed. As I lift the bed, I want to make sure, again, that we're doing proper body mechanics, so I want to have an appropriate height for me. I don't want to be hunching over as I do this. All right. And then from there, I'm going to bring in my catheter kit and the tray as well. Okay, so what I would do next is I would go ahead and give privacy to the patient. So I'm going to roll down the blanket, rolling it down far enough to make sure that I have enough room to place some stuff as I need it. And then from there, lifting up the gown again, giving as much privacy as I can, and then reposition the patient as needed. So I'm going to try and have the knees bent with the legs out a little further. That way, if possible, if they can't due to the injury, we can keep their legs straight and just try to have their legs out wider again. Okay, so from there, I would go ahead and I would take down the bed rail, making sure that I no longer leave the patient's side. Okay, now I'm going to go ahead, I'm going to take my gloves off, and I am going to discard my gloves. And now I have my catheter kit, and I'm going to perform hand hygiene before I get into the catheter or into the kit. When I do my hand hygiene, I want to make sure that if I'm using sanitizer, that I rub thoroughly to make sure that the hand sanitizer is dry. And then I am going to take out the kit and making sure now that I'm getting into the catheter, that I never dip my hands below, okay? So I'm gonna open up just with that 1-inch border away from me. Now the other ones will go out to the side, and then lastly, opening up to me. Again, just that 1-inch border, and then I'm gonna go ahead and I'm gonna turn this just a little, and then I am gonna get my gloves and start donning my sterile gloves. So, from here, taking my gloves out, again, making sure that my hands never dip below. So I'm just pitching that, and now I'm onto my gloves. Opening my gloves and making sure there's this little border in here that I'm only grabbing that border, and then I'm going to spread out a little further. Same thing, just grabbing that border and spreading out a little further. Okay. There we go. Okay, now I will don my sterile gloves, making sure for this one that I don't touch the outside, that I'm just doing the inside of my gloves. Okay, and then from there, I'm going to the next one, and grabbing just that inside cuff and pulling up. Now I'm done with my gloves, pitch them, again, keeping my hands above, and now I can go ahead and adjust my box. So I have my first drape. This first drape I am going to place underneath the patient. I want to wrap this around my hands, ensuring that I won't touch anything that I should not, to keep my hands sterile. Okay, the second one I'm not going to use, so I'm going to go ahead, pitch that to the side, and now I have my box that I can adjust. So I'm not going to use my sample. We're not collecting urine sample, so tossing that to the side, or pitching it, and then from there, I am going to move everything into one box so I can take everything over to the patient. So we are going to set those in there, and then I am going to take this off first. I'm going to take this off second. I'm going to go ahead and put my lubricant in here, so I have that ready. Now I'll go ahead and I will remove this, making sure that as I do it, I try to coil this up or grab near the top, and then pitch that to the side, throw it away. That way, I coil it up so it doesn't fling around and it doesn't touch the non-sterile field. So now I'm going to go ahead and lubricate. There we go. All right, and now I'm going to go ahead and place it back inside of the box. And grab this, or my syringe, and now I'm going to attach to where it needs to be. And now I have everything set up in this box. So I no longer need this. So go ahead and toss it, throw it away, and now I can adjust my box. And now everything is in my box, so I'm going to pick it up and take it to the field, so I no longer have to move it around. So pinching the inside, make sure that I'm not getting anything that I shouldn't. And now I'm going to take it, I don't know how that looked. Here we go. Okay, so now I'm going to go ahead and adjust it there. And now I have to clean the area with my swabs. So grabbing at the base, starting close to the urethra, just around, and then I'm just throwing it. Close to the base, just a little further away this time, throwing it, and then the last one a little further away than that one before, and throwing it. Okay, so now I have my catheter. I want to coil it up a little bit, and now I'm going to insert my catheter. I'm going to insert until I see urine flash, and then I'm going to insert it just a couple inches further to ensure that the balloon is in there. Okay, so now I can go ahead and I'm going to grab with my other hand, and I'm going to grab this syringe and push the saline to inflate the balloon. All right, so now that it's apart, or now that the balloon is inflated, I'm going to take it off, drop it there, and now from here, it's no longer a sterile procedure. I can touch around here and I can grab it, attach it to the stat lock, and then put it onto the bed, making sure that it's below the height of the patient and below the bladder of the patient as well, and put it on the part of the bed that does not move. Okay, so after that, we would clean everything up. We would cover him back up, make sure that he doesn't have any discomfort or any other concerns. Give him his call light, perform hand hygiene, leave, and documents. A couple days later, or whenever the physician would have the orders, or provider would have the orders to remove the catheter, we would come back in, we would start back over. So I would perform my hand hygiene, talk to the patient, make sure they understand what we are going to do today, and then do patient identifiers, so name, date of birth, double check with the wristband to make sure that we have the correct patient, and then we would go ahead and get started. So it's no longer a sterile procedure, it's just a clean procedure. So I just need my clean gloves. For this demonstration's sake, I'm gonna leave my gloves on, but I would don my clean gloves after I perform my hand hygiene, and then I would have my I would have my syringe to remove the saline. So I'm going to insert it, and then remove the saline. Before I would start to remove, I would make sure that the bag is empty, just in case if I need to remove any of the urine that may be in the bag. There was no urine in the bag, so now I would go ahead and I would have the patient cough or take a deep breath. As he does that, I would remove this nice and easy and make sure that this isn't flipping around. From there, we would take the bag and we would discard it in a biohazard bag. After we discard it, I would do the same procedure as before. We would clean everything up, make sure that he doesn't have any discomfort, address any problems, issues or problems that he may have, cover him back up, and put the blanket back up, give him his call light, perform hand hygiene, leave, and document. Before I would actually leave, I wanted to show this at the end, that way I didn't have to address it twice, but before I would leave, I would make sure that the bed rail is up, and then again, same thing, cover him up and lower the bed before leaving.